Welcome to today's webinar titled Open Season is Here, your guide to TRICARE Open Season and Federal Benefits Open Season. We are thrilled to have with us today Mark Ellis, Senior Health Program Analyst, TRICARE Policy and Benefits Office with the Defense Health Agency, and Dennis Hodges, Project Manager of FEDVIP Transition, Individual Benefits and Life, Healthcare and Insurance with the Office of Personnel Management. So without further delay, let's turn things over to Mark Ellis.
Thanks, Dan. And thanks everybody for joining us to talk about open season. So let me just move on to the second slide. So this is a disclaimer that basically talks about the hyperlinks that we have in the slide package. So let me get the legalistic stuff out of the way. The appearance of hyperlinks does not constitute endorsement by the DoD of this website or the information, products, or service contained therein. For other than authorized activities such as military exchanges and MWR sites, the DoD does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this DoD-sponsored webinar. Okay, what does that really all mean? So the good news is the links that you're going to see in our presentation today are either DoD or OPM websites or authorized websites where you can get information on TRICARE and FEDVIP plans. So let's move on and talk about what we're going to talk about. So on slide 3 is our agenda. So I'm going to first cover the TRICARE Open Season overview, and then Dennis Hodges from OPM is going to cover the FEDVIP Open Season. Stan mentioned that you can submit your questions via the web tool. I'd encourage you not to submit any questions till we get through that particular section of the presentation. We are providing a lot of information today, and oftentimes we find that folks submit questions early on and we've answered that question. So we spend more time restating things. So please, if possible, wait until I get done with the TRICARE Open Season before you submit any TRICARE Open Season questions, and do the same for Dennis until he finishes the FEDVIP Open Season. So with that in mind, let's jump into the TRICARE Open Season. So I'm on slide 4. So basically, TRICARE is now required by law to have a similar health plan enrollment process that commercial health plans do. That is, there's an annual open season where you can elect to enroll in or change your coverage. And there's also qualifying life events that occur that you can make changes at other times. But today we're talking specifically about annual open season. It's the annual period where you can enroll in or change your health plan. This will happen every year. So this is our inaugural open season, but this will happen basically every November and December on the timeframes indicated on the slide. The choices that you make during the open season for your TRICARE plan will take effect on 1 January of the following year. So in this case, the changes you elect to make during the TRICARE Open Season this year will be effective 1 January 2019. Our open season is November 12th, 2018 through December 10th, 2018. And when Dennis gives his presentation, you also hear that it's the same open season period as FEDVIP. On slide 5, let's talk about what open season doesn't apply to. So open season applies to those that are eligible to enroll in TRICARE Prime or TRICARE Select. So for those folks that are eligible to enroll in other TRICARE health plans, like TRICARE Retired Reserve, TRICARE Reserve Select, TRICARE Young Adult, and the Continued Health Benefit programs, those programs have what we call continuous open enrollment. That is, anytime during the year you can elect to enroll in one of those plans. Also, TRICARE Open Season for the purpose of TRICARE does not, repeat not, apply to those who are in the TRICARE for Life program. There's no enrollment required for TRICARE for Life. Merely you have to have Medicare Part A and Part B, and then TRICARE for Life is automatically provided. On slide 6, let's talk about your options during the TRICARE Open Season. You have 3 options. First and foremost, if you're currently enrolled in TRICARE Prime or TRICARE Select and you like your health plan, you need to do nothing. and you'll remain enrolled in either the plan you're currently in for the next year or until you, as long as you remain eligible to be enrolled. You can enroll in a plan, either Prime or Select, again, starting on 1 January, or you can change the plan that you're in. And you can also change from individual coverage to family coverage. So where do you find out more information about that? TRICARE.mil/open season is where you'll find all the information on how open season works and links to where you need to go to get the information. So quick comparison on slide 7, TRICARE Prime and TRICARE Select. Prime is an HMO option, which means you have a primary care manager who provides or arranges for all your care. On the other hand, TRICARE Select is a preferred provider PPO style option where you basically can select any TRICARE authorized provider. Prime, you need an authorization to get care that your PCM can't provide for you. TRICARE Select, generally referrals aren't needed. And so you can go through the rest of the issues here. If you go to the TRICARE.mil website and put /compare, you can look at the comparison between these two plans. You can also find information on the out-of-pocket costs that are associated with each of these plans. So how do you make an enrollment choice? On slide number 9, there's 3 ways to make an enrollment choice. First, the easiest way, if you're internet savvy, is to go to the beneficiary web enrollment website. The URL is the website is listed there. It's not available to those who live overseas, but this is an easy way for you elect to make a change in your TRICARE Prime or Select coverage, and you can do that 24/7 pretty much. On the other hand, you can pick up the phone and call your TRICARE servicing contractor. On the slide are the list of the various phone numbers for the various regions. And then finally, you can download an enrollment form and mail or fax it in, and you see the URL there where you can download the form. And again, TRICARE.mil/enroll will give you more information on how to effect an enrollment. And so on slide 9, there are a couple of things that we know folks have asked us in the past, so let me quickly go through those. So if you enroll in TRICARE Select during the open season and you realize, oops, I really want to be in Prime, during the open season, you can make changes to what you previously elected. So after we get through the open season period, otherwise, the only way you can make a change in your TRICARE coverage starting 1 January 2019 is if you have a qualifying life event. When you go to the enrollment, TRICARE.mil/enroll, you'll see information about what qualifying life events are. And then during the open season, is it a one plan fits all family member size? The answer is no. It's up into the families to determine what plan you want each of the family members to be enrolled in. Active duty members need to be enrolled in Prime, but pretty much everybody else can elect to enroll in Prime if it's available and if you're qualified for it, or enrolling in TRICARE Select. But you could have a mix of those within the family. Some can be enrolled in Prime, some can be enrolled in TRICARE Select. And so on slide 10, let's talk a little bit about eye exam coverages through TRICARE Prime. So specifically for those that are enrolled in the TRICARE Prime option, TRICARE cost shares on eye examinations. On the other hand, if you're enrolled in TRICARE Select, TRICARE does not cost share on eye exams. So we want to talk about TRICARE Prime. Our TRICARE Prime eye exam criteria and coverage requirements are not changing. My colleague Dennis Hodges from OPM is going to talk about FEDVIP vision plans. So I'm stealing a little bit of this thunder, but I just want to talk from a TRICARE perspective. So routine eye exams are covered for TRICARE Prime enrollees, active duty service members, yes, once a year for active duty family members, and every 2 years for all other TRICARE Prime enrollees, retirees, retiree dependents, and the such. Diabetic patients can get an eye exam every year. The point I want to emphasize is if you purchase the vision plan through FEDVIP, TRICARE is a secondary payer. So whatever eye exam coverage you get through the FEDVIP vision plan you purchase, TRICARE can help pay any other out-of-pocket expenses. So if there is a co-payment through FEDVIP to get an eye exam, TRICARE can be a secondary payer to help pay those out-of-pocket expenses. So how that all works, if you go to tricare.mil/OHI, other health insurance /OHI, you'll find information and help you understand how all that works. Slide 11, again, here's the resources that we've talked about in the previous slides. Please, please be an informed consumer of your TRICARE health benefits. Please utilize the resources that are online. If you're more comfortable calling and talk to the regional contractor, please do so. And then finally, at the bottom of the slide, it talks about signing up to receive TRICARE updates and news via email. TRICARE is a plan that we make regular updates to make improvements for the coverage and also for the benefit. And we also are a fairly highly regulated health plan because most of the direction we get comes from Congress through updates in federal laws. And so to keep up to speed on all those things, we highly recommend you click on the link to receive TRICARE updates and news by email, just so you can keep informed and be knowledgeable about how TRICARE options are changing or information is changing, so you can keep up to speed on that. So I think I've done a good job of getting through the TRICARE presentation. So if I didn't answer your specific question about TRICARE Open Season, this would be a good time to start typing into the web app and tell Stan you'd like to ask a question. With that in mind, let me turn it back over to Stan and to continue our discussion on Open Season.
All right, at this time, I believe Dennis Hodges is going to speak.
Yes. Good afternoon. My name is Dennis Hodges. I'm one of many people that support the FEDVIP program. During the question and answer period, you might hear other voices on the line. They'll identify themselves, but we have a pretty good team here, and hopefully we can answer all your questions. I think it's important for Mark talked a little bit about the TRICARE Open Season. I'm going to talk a little bit about the Federal Benefits Open Season. They are running during the same time period, but they are two separate events. The Federal Benefits Open Season is happening right now. As a matter of fact, it opened on Monday. It's your annual opportunity to enroll in, change, or cancel a FEDVIP dental or vision plan. For folks that are currently in TRDP, the TRICARE Retiree Dental Program, this is a particularly important open season because if they fail to enroll in FEDVIP, they will lose their dental coverage. Their dental coverage in TRDP will end on December 31, 2018. If they want to have dental coverage in January, they need to enroll in FEDVIP. Please note that open season is an annual event. If you're currently eligible and choose not to enroll, your next chance to sign up is in November 2019 for coverage effective January 1, 2020. Unless you experience a qualifying event, what we call a QLE, or become newly eligible during the plan year. For example, if you were newly retired, would be an opportunity. To date, we've had a lot of people that have enrolled in FEDVIP, or a lot of military personnel that have enrolled in FEDVIP. As of yesterday, we had over 130,000 new military retirees in our dental program and over 55,000 in our vision programs. Next slide, please. FEDVIP is the acronym for the Federal Employees Dental and Vision Insurance Program. FEDVIP provides comprehensive dental and vision insurance at competitive group rates available on an enrollee pay-all basis. Currently, in 2018, FEDVIP serves over 3.3 million federal employees and retirees. The program receives high marks for satisfaction from our enrollees. Military retirees and their families may enroll in dental coverage, vision coverage, if they are enrolled in a TRICARE health plan, or both. Active duty family members may enroll in vision coverage. FEDVIP replaces TRDP, which is currently administered by Delta Dental. What does FEDVIP cover? For dental, many of our dental carriers provide nationwide international coverage. Some provide coverage on a regional basis. Most importantly, none of our carriers have waiting periods for services such as crowns or bridges. Please note that some of our carriers do have waiting periods for orthodontia and some do not. For vision, there are allowances for frames, and most have no restrictions on the brand name for frames and or contacts, and there are also discounts for LASIK. So who provides this insurance coverage? We have 10 dental carriers offering 15 plan options. 6 of the dental carriers provide services nationwide and overseas. Those carriers are Aetna Dental, Delta Dental, FEP Blue Dental, GEHA, MetLife, and United Concordia Dental. 4 of the dental carriers provide services in a specific region. Those carriers are Dominion Dental, which serves DC, Delaware, Maryland, Pennsylvania, and parts of New Jersey and Virginia, and Emblem Health, which serves New York State and some zip codes in Pennsylvania, Connecticut, and New Jersey. Humana, which serves 25 states, mostly in the Mid-Atlantic, the South, and most Western states, including California. And Triple S Salud, which serves Puerto Rico. All 4 of our vision carriers provide services nationwide and overseas. Those carriers are Aetna, FEP Blue Vision, United Healthcare Vision, and VSP. Next slide, please. I talked about carriers. Carriers also have what we call plan options. Typically, they will be listed as having a high option or a standard option. Some have both. Some have one option. High option plans typically have higher monthly premiums, lower coinsurance costs, higher orthodontic lifetime limits, and higher annual maximums. Standard option plans typically have lower monthly premiums and a lower maximum benefit. Typically, the amount that you pay when you receive services is greater when under a standard option plan. Choosing a standard option plan typically reduces the monthly premium expenses, but may cost more for specific services. Okay, next slide, please. What is BENEFEDS.com? If you don't remember anything else from the presentation, I'd like you to remember that open season is now. It ends on December 10th, and the place that you go to enroll is BENEFEDS.com. BENEFEDS.com is the online portal for enrolling in FEDVIP Dental and the FEDVIP Dental and Vision program. You can access the portal by using your personal computer, your smartphone, or a tablet. Prior to enrollment, there are tools that you can use to check your eligibility, to make sure that you understand that, and to compare the plan options that you have for both dental and vision. During federal benefits open season, which is now, you can enroll in your choice of dental or vision plans at benefeds.com. Next slide, please. And as I stated before, benefeds.com is the portal for where you can enroll. The process for creating an account and enrolling is a lot like going shopping on Amazon. You provide basic information, but there are 4 steps. First, you verify your eligibility. Under what conditions are you eligible to enroll in FEDVIP? You create a benefits account. That's where they're going to ask specific information about your name, your address, your email, etc. And you can select a vision or dental plan after you've done some online shopping, and you can confirm your plan choice and the person's covered when you complete it. And then you will receive an online confirmation right then and there that you can print out and save, or print out and or save for confirmation of your enrollment. You will also later receive an email toward the end of, not an email, a letter toward the end of December that will also confirm your purchase. You'll have that for your records as well. If you have any questions during the enrollment process, or if you are unable to enroll online, you can call BENEFEDS at 1-877-888-337. I'm going to give you that number again. That's 1-877-888-337. or 1-877-888-FEDS, F-E-D-S. The fact of the matter is that over the last 3 days, we've received a lot of very positive comments online about how easy it is to enroll via social media. I've also spoken to people. This morning, I was actually at the Pentagon at a health fair promoting the program, and we spoke with several folks, and they said it was a very easy tool to use, and it did not take them that long. Next slide, please. So I'm going to go over those steps a little bit, and hopefully these slides will give you a mental picture of the process. The picture of the phone over there to the right is just to remind you that you can do this on your smartphone or on your tablet, as well as your PC. To verify your eligibility, you will answer a few simple questions. These questions will help BENEFEDS determine the basis for your eligibility, meaning if you are a uniformed services retiree, an active service member, or a survivor, or if there's there are other categories, or if you fall underneath other categories. If you look to the right on the picture of the computer screen there, you'll see a little blue box. That actually, throughout the process, you will see additional information in that blue box to the right that is to help you understand what the questions are about and to explain any definitional issues. So once you complete the eligibility, you will get a confirmation, an eligibility confirmation. And so at the end of the eligibility process, you'll be asked to certify that the information that you've provided is correct, and you simply check the box, and you will and then you go on to creating a BENEFEDS account. Step 2 is to create a My BENEFEDS account. Once you've verified your eligibility, you'll provide the basic information that BENEFEDS needs to enroll you and or your family. The website is secure, it meets federal standards, and that helps ensure that your information is secure and your privacy is protected. Only the names, date of birth, and gender of family members are required, so you don't have to go searching for their Social Security numbers or other identifying information. And the information that you provide is exactly the same information that every federal civilian employee that enrolls provides. Next slide, please. Once you've provided the necessary information to create an account, you will receive a confirmation that your account has been created and that you can continue on to enrollment. Once your account is created and you've saved your profile, you don't have to verify your eligibility or create an account again. So we actually had about 15,000 people that created accounts last Friday prior to enrollment, and they were ready to go when they are ready to go on Monday to enroll. So you can get this far in the process. You can save the information if you still want to do research, but this gets you started in the process. Next slide, please. Step 3 is the comparison. So at this point, you will provide basic information on whether you want to select a dental plan, a vision plan. You'll provide your zip code, which will help us to limit it to only those plans that serve your area. Remember before when I talked about Humana, who only serves 25 states, or the SSS Salud, which only serves Puerto Rico. So in this instance, it's going to just provide you with the plans that serve your geographic area. You will also be prompted to check the frequency of payments. In most cases, for those on the phone, that would be for monthly payments. Some of the other agencies have other frequencies, and in the civilian world, we get paid once every 2 weeks. So, but you will more than likely select monthly payments. So once you select that, it will give you an option of all the plans that serve your area, and you can do side-by-side comparisons. And I apologize. Thank you for moving the slide forward. I apologize for the heading not being clear here, but we didn't want to necessarily advertise for a particular plan during this webinar. In this example, you see 3 standard plans. You'll see the comparison of the premium payments. I'm going to talk about that a little bit. And if you go down to the bottom, you'll see that it talks about what your co-insurance payments would be for a preventative service. A preventative service is going to get your teeth cleaned or have your examination. Intermediate services would be more intense. But it gives you a side-by-side comparison. You can also get very, very detailed in the plan comparison tool, and you can actually read the statement of benefits, which provides exactly what is covered down to the dental code, including what the payments will be for that service, as well as any exclusions, which in most cases is not that great, but you can get very granular when you are making your comparisons. This allows you to shop for the plan that you think will best meet your and your family's needs. I'm going to talk a little bit about self plus one, and self and family. If you are enrolling just for your coverage, that would be a self coverage. If you are enrolling for yourself and a spouse, or yourself and a child, that would be self plus one. If you are enrolling for yourself, your spouse, and your child, that would be self and family. So I understand that this is a little bit confusing because it's new terminology for you, but for you, if you have any questions, please add about that. Please ask them when we get to the end. Okay, next slide, please. After you've selected your plan, selected who will be, or basically specified who will be covered, and you have basically made your choice, you're going to see the screen that we have here, which is a confirmation. You will be asked to confirm your choice. And across the top it says, congratulations, your dental enrollment is complete. You have the option of giving BENEFEDS an email, and if they can send you a confirmation via email as well. If you decide to enroll online, you will also receive a confirmation. If you give them an email address, they will send you a confirmation for the enrollment process. So this is just the last check, just like when you're shopping on Amazon or anywhere else. They ask, are these are the items in your cart? This is the equivalent therein. It's a little bit hard to see because of the slide, but it does tell you when your premium is the effective date. Once you sign up, you do not immediately get coverage. You get coverage January 1, 2019. Next slide, please. So we get a lot of questions, and I think there's going to be some confusion on this, so I'm going to talk about the FEDVIP premium payments. As part of the FEDVIP enrollment process, you'll answer questions to determine your eligibility and if you have enough funds available to cover the premium through an allotment. Based on your responses, BENEFEDS will automatically set up an allotment with your pay provider to collect your FEDVIP premiums post-tax. If you don't have available funds for an allotment to cover your FEDVIP premium, BENEFEDS will default your payment method to a recurring electronic funds transfer, which BENEFEDS refers to as an automatic bank withdrawal, or an ABW, because everybody's got to have their acronyms. The very first FEDVIP allotment will be collected from the February 1, if you're a retiree, pay for FEDVIP coverage in January. Automatic bank withdrawals will be taken on January 8th. There's going to we anticipate a little bit of confusion for retirees because under the TRDP, the current dental program for the military retirees, they collect money prospectively, meaning they collect it ahead of time for the month. And in the FEDVIP program, we do things a little bit differently. We collect it retrospectively, meaning after the coverage period. So that means that there will be a collection from TRDP at the beginning of December. Mark, hopefully you'll correct me if I get this wrong, or someone will. And then there will be a pause there'll be a pause, and the first premium payment will be in February. So there will be no premium payment in January that shows up on your pay stub, basically. Next slide, please. The next three slides are some frequently asked questions. I thought we would cover those very quickly. One question is, what happens if I change my mind after I enroll during federal benefits open season? If you go in, enroll, pick one plan, and after that you have a chat with a friend or colleague and they change your mind, as long as you make that change during open season, there is not a problem at all. So you can change. All you have to do is go back, log into your BENEFEDS account, and say, I would like to, and basically enroll in a different plan. Can I enroll in FEDVIP after federal benefits open season? The short answer is no. You can only enroll in a FEDVIP plan outside of open season if you experience a FEDVIP qualifying life event. Again, that QLE expression that allows you to do so. And that means that your first opportunity to enroll in FEDVIP coverage during the federal, or the next opportunity that you would have would be the next year. Next slide, please. This is also frequently asked. It says, I am or my child is in the middle of dental work. A typical example is orthodontia in this instance. How do I make sure that my treatment continues to be covered under FEDVIP? Our FEDVIP, the dental carriers, will cover in-progress dental treatment for current TRDP enrollees who enroll in FEDVIP for the 2019 plan year. This means that the FEDVIP carrier you choose will cover orthodontic services and, in some cases, other covered services that start on or before December 31st, 2018, but are completed in 2019. And that, of course, is going to be up to the FEDVIP policy limit, or the limit for the plan that you enroll in. FEDVIP carriers will not cover in-progress treatment if you enroll in a FEDVIP plan that has a waiting period or does not cover the service. There are several FEDVIP dental plans with options that offer orthodontic coverage within a 12-month without a 12-month waiting period and without an age limit. There are no other waiting periods for services. However, there may be some plan-specific limitations and exclusions. All that is a very long way of saying that if you or your child is currently in receiving services, you would be well advised. It would be a good idea to reach out to the carrier that you've selected. And again, going back to the plan compare, you have the phone number for each and every carrier. You also should have received a letter from our friends at DHA that provides the phone number for each and every carrier. Those letters are, you should have already received it, or you should be receiving it soon. You can call them up and talk through what services you're receiving and what your concerns are. I would strongly recommend that you make sure that it will be covered. Next slide, please. Okay, I answered this question a lot this morning while we were over at the Pentagon, because we have a lot of military retirees that have since become civilian employees. They're already enrolled in FEDVIP. We are aware that there are some people that have FEDVIP and TRDP. They may have coverage through a spouse, but if you're already enrolled in FEDVIP, because you're a civilian or your spouse has it through their place of work, and you don't really need to do anything. You're already covered. You can certainly, during open enrollment, you can go in and you can change your plan options. You can make a new choice. You could choose to drop your coverage. You can do all that during open enrollment. But if you are currently enrolled in FEDVIP, you don't really need to do anything unless you want to make a change. And I've already alluded to the answer to the next question, as I am a federal employee and a military retiree. Can I enroll twice, once as a civilian and one as a uniformed services retiree? And again, the short answer is no. Under FEDVIP regulations, you can only enroll yourself and your family once. Next slide, please. So thank you very much. We at OPM are very excited about serving those that have served our country. If you have any questions, I hope that you will have an opportunity to ask them in the next few minutes. Thank you.
All right, thank you, Dennis and Mark. So let's get right into the questions, since we only have about 20 minutes left. The first question reads, at the end of TRICARE Standard program, my spouse was automatically enrolled in TRICARE Select, and we were told that she would have to go through open enrollment this year. Now, everything I see says that if she wanted to stay in Select, she doesn't do anything. Please clarify.
So thank you for the question. So yes, we converted TRICARE Standard to TRICARE Select for those who had Standard as of the end of last year, and automatically enrolled them. So this is our first TRICARE Open season. So if you want to change TRICARE Select to TRICARE Prime, this is the opportunity to do so. Next question.
Thank you. Retired husband and he passed away. I'm not sure what I'm enrolled in. How do I find out?
So there's a couple of different ways, but the easiest way is pick up the phone and call your regional contractor. The phone numbers are on the slide, and they can assist you, and they can also talk you through any of the answers to questions regarding the differences between TRICARE Prime and TRICARE Select. Next question.
Okay. Next question reads, I heard there are videos and other webinars about the TRDP to FEDVIP transition. Can you tell me more?
Hi, this is Kathleen at OPM. Yes, you heard correctly. You can watch videos about FEDVIP by putting the word OPM and YouTube into a search engine such as Google or Bing. This will bring up OPM's YouTube page. You can view the OPM-sponsored webinars on demand. Click on the Events tab at tricare.benefeds.com. Thank you.
Thank you. Next question reads, I qualify for BENEFEDS under TRICARE, and as a survivor annuitant under OPM, does it make a difference how I apply?
No, it does not. All the premium payments are post-tax for annuitants, so and the premium costs are the same for both the civilian and the military population.
Okay, thank you. We live overseas and submit our claims through TRICARE Overseas. Do we need to select one of the plans? We also plan to move back to the States partway through the year. So how will that impact all of this?
So hi, this is Mark Ellis. So from a TRICARE perspective, if you move back to the U.S., you have an that's a qualifying life event because the health plans that you have overseas are different than the ones that we have here in the continental United States. So that's a qualifying life event. You can elect to change your coverage within 90 days of your move. The coverage that you're currently enrolled in, in overseas, you should continue to submit your claims to the overseas contractor. Thanks for your question.
Okay, thank you. We had Delta Dental through TRICARE, and I wanted to know if the Delta Dental High is the same as the Delta Dental Enhanced.
Hi, this is Kathleen from OPM. No, it is not the same. We have a choice of 10 dental carriers, including Delta, and since it is a different contract, it's a contract with OPM, the plan benefits and premiums are different. We encourage you to use the plan comparison tool on benefeds.com or even call Delta to find out more. Thank you.
Okay, thank you. What does co-insurance mean if it is 20%? Is that what I pay 20% of the cost of care, or is the percentage paid by the dental plan?
Yeah, so co-insurance, the short answer is 20% would be what you pay, and that amount will depend obviously on the service and the negotiated price for the service between the carrier, the insurance company, and the provider. So yes, the answer is 20%. It'll be 20% of the charge. And again, I would encourage, if you go and look at the very detailed brochures that are available on the Plan Compare website, they will actually provide information on what that percentage is, how much you pay, and a much better explanation than I can give over the phone. Thank you.
All right, thank you. Next question. If I enroll in FEDVIP Vision just for myself and this becomes my primary payer, what happens to my spouse who is covered under TRICARE Prime but not FEDVIP Vision? Will she still get her eye exams via TRICARE Prime?
Yeah, so your TRICARE Vision benefit will remain the same, as will your spouse's. So there will be no change there at all. You will have if you enroll just yourself, will have a much richer benefit for coverage of frames, lenses, contacts, and even discounts on LASIK surgery.
Hi, this is Calvin as well from the customer service team, and thank you for explaining that because people also need to understand that as a retiree, you are authorized if you're TRICARE Prime, you are authorized one vision exam every 2 years unless there is an underlying medical condition that you qualify to have one done every year, such as if you're a diabetic. So as TRICARE Prime, as a retiree, it's one vision exam every 2 years. So please understand that, and I believe a lot of the FEDVIP plans, because I know the one I have does authorize every year. So you need to look at that and weigh the benefits where it pertains to you.
Okay, thank you. Next question reads, what is the virtual benefits fair?
Hi, this is Kathleen from OPM. The 2018 Virtual Benefits Fair is now open. The fair enables you to easily find the information you need to learn more about BENEFEDS and FEDVIP. At the fair, you can download an individual carrier's plan information, access program links, or even chat with program representatives on set days. Many carriers have educational videos and other content designed to help you make informed decisions about your dental and vision benefits. As you visit the booth, you can save plan brochures to your online briefcase, which will be available to you throughout open season. You can find the link to the Virtual Benefits Fair using the Events tab on tricare.benefeds.com.
Okay, thank you. Next question reads, can you address any changes to the dental plans for retirees?
In each brochure,
Go ahead.
The TRDP is ending December 31st, 2018. That's the current plan administered by Delta Dental through DOD. So you are military folks are now eligible to be in FEDVIP, and you need to enroll during this year's open season from November 12th to December 10th. You can enroll online at benefeds.com. You can enroll by phone. We encourage people to call the number that Dennis provided before, 877-888-3337. Once you are ready to enroll. For questions about what an insurance carrier will cover, you should contact each individual insurance plan or look online. The best time to call BENEFEDS is early in the morning or late afternoon and evening. We've had robust phone call volume, which is great, but we encourage people to call early or late to reduce any time that you may need to be on hold.
Yeah. And the call center hours are Monday through Friday, 8 a.m. to 9 p.m. East Coast time.
All right, thank you. Next question reads, we were caught in the OPM data breach a while back. How is the system secured now?
Hi, this is Padma Shah at OPM. BENEFEDS was not part of the OPM data breach, which is the enrollment portal for this open season enrollment process.
Okay, thank you. Next question reads, are the in-network providers the same for TRICARE and FEDVIP? If not, where can I find a list of FEDVIP in-network providers?
Go ahead.
Hi, you can find out the plan information by going to benefeds.com, and each of the plans are listed. There is a plan provider directory, and you can look up for dentists in your area. It's usually done by zip code, and you can pick out the miles range to find out which network, which dentists participate in each insurance carrier network.
Yeah, but I'm going to add a caution to that. So just because that a dentist is in the network right now may or may not be true next year. That's just, it is a fact. They're not signed on for life. It is a business arrangement, and dentists do sometimes drop from a network.
And this is Mark Ellis. Let me caveat that also for seeing vision providers for TRICARE and also for the FEDVIP vision. Dennis is absolutely correct. The contractors do the best job they can to keep an online directory updated of providers that offer covered services. But you can call and talk to the plan, or even more importantly, when you're seeking services, ask the provider, in this case for an optometrist who's doing a vision exam, do you take TRICARE and do you participate in my vision plan? And so be a good consumer and make sure the providers that you're seeing take the coverages which you have. Next question.
Next question reads, do dependents have to be enrolled in DEERS to be eligible for dental and vision?
Yes, the dependent needs to be enrolled in DEERS because they need to be determined to be a DoD eligible dependent, and that's the official enrollment system.
Right.
Yes, this is Mark.
Right.
You need to be an eligible beneficiary, and you should be registered in the DEERS database as such.
Okay, next question reads, I'm a military retiree and this seems too easy. Who handles the paperwork with DFAS? Do I have to unenroll and re-enroll with DFAS? I'm a military retiree and this, okay, he said, okay, so that was the end of that. I'm a military retiree and it seems too easy. Do I have to, who handles the paperwork with DFAS? And does he have to unenroll and re-enroll?
No, it's going to be Delta Dental, the current TRDP provider, is going to be stopping premium payments for 2018. No action is needed on behalf of the military retiree. For FEDVIP, as we said, when you do the registration process, you are answering questions concerning your eligibility and any retirement pay that you are receiving. Based upon that, our contractor BENEFEDS will work with DFAS and other pay systems to start up that premium collection from your annuity. So there should be no action needed on the military retiree's part besides enrolling for coverage on benefeds.com.
Yeah, and going back to the questioners, this seems too easy. So I don't want to leave you with the notion that we're just going to reach out to them. No, we've been working with DFAS and all the service pay providers for roughly 9 months to make sure that that transition goes smoothly.
Okay, next question. What did TRICARE Standard change to?
Hi, this is Mark L. So TRICARE Standard changed to TRICARE Select. So we received congressional direction in the National Defense Authorization Act for 2017 to terminate end the TRICARE Standard Extra program and replace it with TRICARE Select, which still offers a preferred provider option, but it also includes options for co-payments instead of cost shares when you see network providers. Next question.
I will be enrolling in FEDVIP Dental, but before I do, I have a question. My wife and I currently have different dentists who are in network with the provider I will be choosing. When I enroll, does the system allow me to identify separate dentists for myself and my spouse?
Hi, this is Kathleen from OPM. For most of our dental carriers, you do not need to list your dentist that you plan on going to. We have one dental HMO, and that carrier may require you to list a dentist. You would need to contact them for more details.
Right.
Thank you.
Okay, and the last question that we're going to take today reads, I'm currently a federal employee and participate in FEDVIP. Is there any advantage in enrolling in FEDVIP through TRICARE and canceling my FEDVIP as a federal employee?
So my understanding is that this person is a civilian employee currently. So there is no advantage. There is actually a disadvantage because as a civilian FEDVIP employee, you pay for your premiums pre-tax, and under the military, as a retiree, you would pay post-tax. That is actually sort of an employee benefit, but once you become a retiree of the civilian program, the same thing would apply. So you would be paying post-tax then as well. So if you are currently a civilian employee, it's to your advantage to keep FEDVIP under the civilian classification because you would be paying those premiums pre-tax.
All right. At this time, I would like to thank our presenters, Mark and Dennis, for sharing this information related to this very important topic. I would also like to thank our attendees for participating in today's webinar. If we did not answer your question today, please visit tricare.mil/open season. At this website, you will find information about both TRICARE Open Season and Federal Benefits Open Season. This concludes today's webinar on Open Season is Here, your guide to TRICARE Open Season and Federal Benefits Open Season. Thank you all for attending and have a great day.